बिस्मिल्लाहिर्रहमानिर्रहीम। इय्याका नअबुदु व इय्याका नस्तईन। अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लल्लाहु व सल्लिम अलैहि। Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. This is a male 16-year-old patient with history of bilateral mild pain in the flank region, renal area. तो इसको बहुत मामूली जो है ना पेन होता है दोनों फ्लैंक एरिया में. सो आई एम गोइंग टू स्कैन द बोथ किडनीज. Here we can appreciate patient is in the right decubitus position, and this is the right kidney. This is the upper pole and this is the lower pole of the kidney, and in between two poles this is the mid pole. Radiologically it is called interpolar region. We cannot say it pole, it is a region between the two poles. Only two poles are present radiologically, sonographically in the kidney. One is the upper pole here, and this is the lower pole. And in between, to be very easy for the reporting, so we use this term mid-polar region or interpolar region. And this hypoechoic area is relatively less hypoechoic is cortex, and this echogenic line is the capsule. So this cortex is the outermost layer of the kidney, and then this area which is bright, diffusely bright, this one, this one, this one, and this one, and this one, this is the pyramids, medullary pyramids. And cortex is on this is the anterior side and this is the posterior side. So this is the anterior cortex and this is the posterior cortex. Same is with the pyramids. This is the pyramids are the medullary pyramids. We call it medullary pyramids. What are the pyramids? This is the medulla of the kidney. So kidney has cortex, medulla from the outer to inner. Outer is the cortex and then inner is the medulla. And in between the cortex and medulla, there is a here it is not easily appreciated. In between is the central sinus, renal sinus we call it. So these are the normal anatomical detail. So when we talk about the cortex and pyramids are dark, hypoechoic. It should be hypoechoic. And here we can appreciate these are the pyramids. These are not dark, these are brighter significantly, and these are diffusely brighter. All are echogenic. This one. Look here, we can appreciate on the real image. साइलेंट करो. So अब हमने देखा कि किडनी का एक अपर पोल होता है, एक लोअर पोल होता है. this is upper pole and this is a lower pole and it is a, और ये इंटरपोलर पोलर रीजन है और ये कॉर्टेक्स उसका एक पार्ट है आउटर लेयर और उसका इनर पार्ट है मेडल्ला। मेडल्ला जो है ना वो सोनोग्राफिकली पैरामिड्स शो होता है और उसके दोनों के दरमियान में सेंट्रल एरिया होता है जिसको हम रीनल साइनस कहते हैं। अब ये डार्क होने चाहिए, दिस शुड बी ब्लैक एज कंपेयर टू द cortex. Here we can appreciate these pyramids are diffusely hyperechogenic. ये सारे echogenic हैं. It is not a single one. So this is not normal. Why pyramids क्या होते हैं? ये renal medulla होता है, ठीक है. एक cortex हमारे किडनी में होता है, दूसरा medulla होता है. तो जो medulla होता है वो एज ए pyramids रिप्रेजेंट करता है. अच्छा, we already know that most of the blood supply goes to the cortex. Almost 80 to 90% blood supply goes to the blood flow goes to the cortex because these contain the glomeruli, nephrons, and which work for the filtration. So most blood flow goes to the cortex and less blood flow goes to the medulla or pyramids. So these pyramids, what is the present within the cortex? Uh, because it glomeruli are present, and then the tubules are present, proximal and distal convoluted tubules, and in the pyramids, ducts are present, collecting ducts, uh, distal collecting ducts, loop of Henle होता है इसमें, और दूसरा मेरे ख्याल में वो स्ट्रेट डक्ट होती है, फिर छोटी छोटी वेसल वेदर एक्टा होती हैं. तो ये जो है ना इसमें होता है. अब इसका फंक्शन क्या है कि जैसे यूरिन यहाँ से बनता है फ्रॉम द ग्लोमेरुलाई, ये पैरामिड्स में जाता है मिडल्ला में. मिडल्ला जो है ना इसको कंसंट्रेट करता है एंड देन concentrated and then this pyramid which is triangular shape. So this area which is the broader one and this is the conical shape, this is the apex. So this apex has an opening for the calyces. तो ये inferior जो होती हैं माइनर कैलिसेस यहाँ पे इनके इर्द गिर्द होती हैं, सराउंड द pyramid, and at this conical apex there is a opening through where the urine then flow into the minor calyces, and from the minor calyces goes to the major, and the major calyces into the renal pelvis, and from there the urine flow out through the ureter into the uribladder. So this is normal option. So these should be pyramid should be hyperechoic. Dark, dark hyperechoic than the cortex. But here we can appreciate they are diffusely hyperechoic, echogenic. तो ये अर्ली जो है ना इसको हम कहते हैं मेडुलरी नेफ्रोकैल्सिनोसिस. अब क्या होता है नॉर्मली जो है ना ये यूरिन कंसंट्रेट करता है, देन यूरिन गोज टू द कलेक्टिंग सिस्टम, कैलिसिस सिस्टम, और इस तरह ये. तो व्हाट इज द रीजन व्हाई दिस बिकम द hyperechoic? This is due to the deposition of calcium salts, mainly oxalate and phosphate होते हैं. तो जैसे ही कंसंट्रेट करता है तो ऑलरेडी जो है ना इसका एनवायरनमेंट जो मेडल्ला का होता है वो एक तो एसिडिक होता है, दूसरा इसमें लो ब्लड फ्लो होता है ऑलमोस्ट 10%, 5 to 10%, तीसरा इसमें हाईली कंसंट्रेटेड यूरिन होता है. तो इसलिए ऑलरेडी जो है ना जो सलूट मीन का यूरिन होता है, जो इसमें वो साल्ट होते हैं यूरिन में, वो सलूट हो गया ना, तो वो पहले ही यहाँ पे मौजूद होते हैं. जब कैल्शियम ज्यादा होता है ड्यू टू एनी रीजन, तो ये फिर जो है ना इसमें कैल्शियम डिपॉजिट हो जाता है। एनवायरनमेंट भी एसिडिक है, लो ब्लड फ्लो भी है, जिसकी वजह से फिर यहाँ पे कैल्शियम सॉल्ट डिपॉजिट होते हैं। अगर कैल्शियम सीरम लेवल पे ज़्यादा हो, कैल्सियूरिया, हाइपरकैल्सीमिया हो, या फिर ये जो कलेक्टिंग सिस्टम है जिसको हम कहते हैं कि ये हाईली एसिडिक हो जाए, काम करना छोड़ दे, देन दिस जो है ना salt deposits here in the collecting ducts, so these then pyramid appear hyperechoic क्योंकि यहाँ पे कैल्शियम डिपॉजिट हो रहे होते हैं। तो दिस when the condition further worsen, then the crystal formation occur and then the calcification occur and these again become highly calcified, and then further it may give the shadowing also. So this is diffusely hyperopic, but no such calcification and posterior shadowing is seen. So we can say that this is the case of medullary nephrocalcinosis. It is early onset क्योंकि यहाँ पे हमें calcification नजर नहीं आ रही, and we are not appreciating the calculi also or posterior shadowing. So this is the one kidney I am going to show you, which is showing the hyperechoic pyramids, medullary pyramids. So then now I'm going to scan the other kidney. What is the condition of the other kidney? I have used the harmonics of the ultrasound. So here we can that make it very clear for the pyramids. So we can better see the pyramids, how these are hyperechoic. So now I'm going to scan the left kidney. The patient is in the left decubitus position, and here we can also appreciate this all pyramids are, whether they are anteriorly located or posteriorly located. So these are hyperechoic, echogenic. So we can say that there is symmetrical involvement of the bilateral all pyramids, and these are symmetric and uniform distribution of the pathology. Here also we can appreciate that the same uh, appearances as the right kidney is having. This is the spleen and this is the look here. There is a rib shadowing which is causing difficulty for clear visualization. However, we have to see it through the ribs uh, to visualize the kidney, to scan the kidney. And so this was all about the bilateral, diffuse, diffusely hyperechoic pyramids with symmetrical involvement involving the all pyramids of both kidney. Likely it is early onset medullary nephrocalcinosis. So maybe we should also go for the parathyroid gland scan and then parathyroid hormone, calcium level, and creatinine level. We should also go for this study. What is the cause of hyperechoic renal pyramids? Is there any pathology? So this will the lab finding will help to conclude. So we can now say that this is the bilateral early onset medullary nephrocalcinosis. Most common causes are in this age group renal tubular acidosis, जो distal tubules होती हैं उसकी acidosis हो सकती है अर्ली और या फिर इसमें इस एज में तो मुश्किल है कि हाइपरपैराथायरॉयडिज्म हो मुश्किल है विटामिन डी भी कॉज करती है या बायलैटरल मेडुलरी स्पॉन्ज किडनीज भी जो है वो कॉमन कॉज हैं मेडुलरी नेफ्रोकल्सिनोसिस की so all these are the common causes the main conclusion we can establish when there is a clear cut blood picture and urine analysis then we can talk about. So this was all about this case. Thank you very much.